This is your Week 7 lecture. This week we look at the lymphatic and digestive systems and their associated medical terms. Here's the lymphatic system first. Here are your objectives for the lymphatic system. They're the same ones you have in Connect. The lymphatic system is the second of our two transportation systems in the body. Like the cardiovascular system, it too transports important fluid in the form of lymph. This helps reduce edema or swelling, returns proteins back to the blood, and moves around elements of our immune system so they can get to where they are needed most. The immune system is usually associated with the lymphatic system as it uses this system for a great deal of its transportation around the body. We need the immune system to fight infections and produce antibodies, which are also known as immunoglobulins. The lymphatic system consists of lymph nodes, also known as lymph glands. These are clumps or clusters of usually immune cells along with lymph fluid. These nodes also provide a means of assisting the immune system, as the lymphocytes contained within can help fight nearby infections. Look at the various regions of the body that contain lymph nodes. There are cervical, axillary, inguinal, and pelvic lymph nodes. When these become enlarged, this can be because of infection or cancer. The lymphatic system consists of lymph, which is the fluid, the lymphatic pathways, and vessels, and the lymph nodes. In addition, there are other organs involved in the system, including the spleen and thymus gland, which produces thymosin, an important hormone in the immune system. There's also T lymphocytes, which come from the thymus, hence the T in their name, and B lymphocytes, which come from the bone marrow. Now for your new vocabulary roots. Adeno means gland, immuno means immunity. Lympho refers to the lymph. Lymphadeno refers to lymph nodes, and lymphangio refers to lymph vessels. Spleno refers to the spleen, of course, while thymo refers to the thymus. We also see toxo, toxi, toxico refer to poisons or toxins. The pathological condition of this system includes one you likely have heard of, which is HIV, or human immunodeficiency virus, which can lead to AIDS, or acquired immunodeficiency syndrome. The immune system can become overactive and cause allergic reactions or become weakened due to diseases like AIDS or cancer, leading to opportunistic infections or pathogens that would not normally infect the body if the immune system was normal. We can test the lymphatic system by imaging studies like lymphangiograms, which can give us a good picture of how the lymph is flowing in the body. CAT scans, which can help us see enlarged lymph nodes or issues with the spleen. There's also a whole host of blood and plasma testing to gauge how the immune system is working. Now we'll discuss the digestive system. Here are your objectives for the digestive system. They are the same ones you have in Connect. The digestive system is one we are all very familiar with, as all of us must eat and drink to survive. Every time you consume pizza, for example, take a bite, chew the food, and swallow, you're using the digestive system from the moment of the first bite. The digestive system and digestion starts at the mouth, and as we masticate or chew our food, adding saliva, then swallowing the food bolus, it then travels down the esophagus in a process called peristalsis, which is when the smooth muscle behind the food bolus contracts while the smooth muscle ahead relaxes, and thus moves the food forward to the stomach through the sphincters that prevent the food from flowing backward. Acids in the stomach further digest the food, and the bolus is churned and mixed and crushed further by the muscles of the stomach. Once it leaves the stomach, it enters the small bowel, where most of the nutrients are absorbed, as the bolus moves again by peristalsis. It reaches the large bowel after a while, and here water is mostly removed. The last stop is the sigmoid colon, then rectum and out the anus with what we could not use. Now for the new terms starting at the top and moving down. Stomato means mouth. Dento and odonto refer to the teeth. Glosso and linguo refer to the tongue. Chelo refers to the lips, while gingivo refers to the gums. Esophago refers to the esophagus, pharyngo to the pharynx, gastro to the stomach, entero to the intestines. Duodenal refers to the duodenum, or first portion of the small intestine. Jejunum refers to the jejunum, which is the second portion of the small bowel, and ileo to the ileum, or the third and last part of the small intestine. Colano or to the colon, sigmoido to the sigmoid colon, and lastly recto and procto to the anus and rectum. There are accessory organs to the digestive system, and they too have root terms to know. Hepato refers to the liver, cholecysto to the gallbladder. Chole refers to the gall, and cysto refers to the bladder. We will see cysto again in the urinary system, pancreato to the pancreas, and salivo to the salivary glands or saliva. Digestion again begins in the mouth or stomato. The food is chewed by your teeth, crushed by the gums and lips. Saliva is added from the salivary glands, which adds enzymes that begin to break down complex sugars to more simple ones. Mastication is the process of chewing. Remember, pharyngo refers to the pharynx, and esophago refers to the esophagus. The food bolus enters the esophagus and travels by peristalsis to the stomach. Gastro refers to the stomach. The fundus is very superior portion of the body, and the body making up the majority of this organ. The pylorus is the last portion of the stomach. The lining is folded, and these folds are called rugae and provide increased surface area for the absorption of nutrients. There are acids and enzymes used here to break down the food in the stomach. And the stomach is also very muscular and will further crush the food. A pathological condition of the stomach is known as gastropathy. Remember, gastro refers to the stomach, and pathy refers to a pathological condition. After the stomach, the food bolus enters the first portion of the small bowel called the duodenum. Remember, entero refers to the small bowel. The small bowel is very long, and is the longest portion of the digestive system. This allows for better absorption of the nutrients we need from our food. The second portion is the jejunum, and finally the ileum. At the cecum, which is at the beginning of the large bowel and end of the small bowel, there is a dead end tube called the appendix. Most everyone has seen or heard of appendicitis, which is the inflammation of the appendix. Right after the cecum, our food bolus enters the large bowel, still using peristalsis, which is made up of the ascending, transverse, and descending colons. Remember, colano refers to colon. The main purpose of the large bowel is to absorb any remaining water from the food bolus. The sigmoid is the last major portion, followed by the rectum and then the anus. Sigmoido refers to the sigmoid colon. As mentioned earlier, there are accessory organs to the digestive system. The liver is vital for filtering out toxins from our blood. It also secretes bile, which helps with the digestion of fats. Remember, hepato refers to the liver. The gallbladder is below the liver and is a reservoir for bile. This is so if we have a large fatty meal, then there will be plenty of bile to digest it. Chole again refers to gall, and cysto refers to bladder. The pancreas serves both the digestive and endocrine systems. Here it secretes enzymes to help us break down carbohydrates and fats. Pancreato refers to the pancreas. When we study the digestive system, we can visualize it with x-rays, CT scans, and MRI scans, but usually the best way to see it is to directly visualize it using fiber optic scopes or bendable long cameras. These are inserted in the mouth for upper GI viewing or in the anus or rectum for lower pathology. Adding the suffix scopy will tell you that a scope is being used. For example, if we are viewing the stomach, then that would be a gastroscopy, or the small bowel would be an enteroscopy, and the colon would be a colonoscopy. Disorders of the stomach include stomach pain or gastralgia. One can also classify this as gastrodynia. Maybe this is due to eating too many Cheetos, or it could be due to a gastric or peptic ulcer from worrying over exam grades. Gallstones or cholelithiasis are the production of hard stone-like deposits in the gallbladder. These can be very painful, especially if they leave the gallbladder and enter the common bile duct. This can cause jaundice or yellowing of the skin due to the buildup of bilirubin in the tissues. If this occurs, it's called cholelithiasis. Hepatitis refers to the inflammation of the liver. Hepato refers to liver, and itis to inflammation. This can be caused by viruses, chemicals, genetic disorders, cholelithiasis, cancers, etc. The most common causes are viruses and alcohol, and this can lead to the yellowing of the skin called jaundice. Colitis means inflammation of the colon, and this can be from viruses, from inflammatory bowel disease, which is made up of ulcerative colitis, or UC, and Crohn's disease. A colonoscopy or endoscopy may be needed to determine which one of these is the cause. Hemorrhoids are enlarged veins at the anus and rectum that can be internal or external. Internal ones are usually not painful but bleed often. The external ones are very painful and also can bleed. This ends your week 7 lecture. Make sure to get some rest.